have one more question on the topic of you were talking about kind of finding the right support network.
Mhm.
And I think often I've heard people say that a challenge for them is when their loved one says, they have a problem with alcohol, they should not continue to drink. Like alcohol is the problem, we need to get them
Right.
abstinent right away. So what would you advise to the family members or to the person struggling with the alcohol use disorder when the answer might be harm reduction is a better approach and taking
Mhm.
alcohol out of the equation may not be the best first step? How do you kind of reassure them or that, or what do you have to say to those loved ones that just want their,
Yeah,
loved one to stop?
yeah. And I can understand that level of desperation, both among the person who wants to cut down or stop, and also among their loved ones. And yeah, it is true. If you've had major consequences, you should probably plan on making a plan to stop rather than cutting down. That's my opinion. And the way to get to stopping is through cutting down first. I'm a really strong believer in this concept, and I feel like the chances are for you to actually stop drinking for good is to sort of go through a reduction first. And from a physical point of view, it then you avoid alcohol withdrawal, which is its own problem. You go from 10 drinks a day cold turkey, you're going to pay the price physically. Again, it works for a lot of people, but I think for a lot of people it doesn't. So what I would tell a family member is like, hey, um, I think we're all on the same page here. Your son really needs to stop completely because of all the consequences and the chaos it's engendering in his life and yours. But what probably works best is getting there over a period of time and make a goal of cutting down. And eventually, then it's easier to stop. So you avoid alcohol withdrawal. If you go from 10 drinks a day to 7 drinks a day to 4 drinks a day to 2 drinks a day to off, and you do that, whatever, a few days or a week at a time, yeah, sure, it's going to take a month to get there, but you're going to have a chance to be better psychologically, utilize coaching, understand your alcohol issues better, and then let the medications do their job. So my sense is that yes, you want to get somebody off, but I believe it works better to do it uh, slowly. And that's not always, but I've seen this work a lot. If people demonstrate they're able to cut down, they might be feeling a little better physically. They might be getting in less trouble at home or at work, and they're going, "Hey, 4 a day. I never thought I could cut down to 4 a day." And they'll come to you and go, "I don't know, I am feeling better, so I want to just keep going on this plan." I mean, I've seen it over and over again. The data we have in reducing alcohol use is based upon numbers, and the number we have best access to are breathalyzers. So you, in real time, you give a breathalyzer, and via the digital interface, literally via Bluetooth, you download an app. The app's on your phone. You set up Bluetooth with your breathalyzer. You blow into the breathalyzer, and literally the data gets entered, and something that your coaches and your medical team can review in real time. And it's not meant as a way of checking up on you and getting you in trouble. It's really a way of keeping you accountable and giving some real data. And so you can better understand the patterns that you fall into when you're drinking.